We just kind of want to check in with everyone. So we're going to do a pre and a post question for you about what you think, how much of an impact we can have locally on improving access to childcare. So, and good afternoon, everyone. I'm Kerry Venegas. I'm the Executive Director for Changing Tides Family Services in Eureka, California. And thank you for joining the session. What we're hoping to get out of this session is a really good dialogue. And so a lot of my facilitation will actually be having Miles and Shannon talk about the concrete steps it takes to put solutions into practice from both a city perspective, so coming from the government public service side, and from a private business, small business perspective, coming from Shannon's side. And then each of the very different kinds of approaches, but complementary approaches that have happened. So what I'd like to be able to do is share just a little bit of background information before we turn it over to the questions for our panelists. And I'm not, did we lose Susan?
I think her connection was she locked up for a little bit, so maybe she's just going in and out.
Okay, no problem. Well, I have a backup to share my screen. Let's see if I can remember how to do it. Let's see. No problem. Susan, can you remind me how to share screen? I think it's this button, right? Okay. New system works. Oh, I'm not sure because once I have to get back to where y'all are. Okay.
Here, I'll share the screen. I'm in now, and it's all good.
Okay. Can you kick me out of it?
No. You have to. Okay.
All right. I was just going to start with the slides and give just a little bit of background about the issue of childcare and why it's an economic, as well as a parent, as well as an employer issue.
Dang it. Just closed out. I was just saying how well everything has gone. Never, ever say that. That's the rule. Okay, we are in. And are you seeing it?
No.
Okay.
No problem. While Susan's getting that up, no worries. I'm going to go ahead and just give you some background. So again, this session is to really bring to light the thread that ties our parents to the workforce. And the impact on employers has been huge, especially during COVID. When families don't have childcare and schools close, that leaves the burden of supporting people's ability to go to work on our childcare providers within our Tri-County region and across our country also. This isn't everybody's concern. And the investments and the ideas for how to make this improved for families and employers is everyone's, not just problem, but everyone's opportunity to solve. And it really, really takes a whole team of us to make the change that makes it easier and better for families to work. Okay, so we're going to look at some best practices at the local government level as well as the private business level, and discuss what those solutions have been and how we can move forward in implementing things that are community specific. So let me just set the stage a little bit. Okay. So Susan, great, awesome. So glad. If you wouldn't mind changing the slide.
Good. We're on it.
It looks very pretty up there. Okay. Next slide also.
Next slide.
Okay, perfect. All right, just to give a little bit of data, we're not going to drown in data. I just kind of want to set the stage. So I'm going to use Eureka as the example because our two panelists actually do operate in Eureka. Households with children under age 18 is about 22.7% of our population in the Eureka area, Eureka metro area. And the number of children under 18 is 5,160, give or take a little bit, because of course these are census data numbers, so they always trail behind, and the most recent census data is not out yet. So pre-COVID, there were 97 licensed providers with 22 centers, 10 after-school programs, 22 large family childcare homes, and 43 small family childcare homes. Why this is significant is that currently we're operating with about 2/3 of that open at this point in the pandemic. Also, to give just some shape to this, the amount of dollars that get spent on childcare in our community is substantial. The numbers that I have concrete information about are the actual subsidized childcare vouchers. And those vouchers are given to parents who fit within the income levels as established by the state and the federal government. So if you're eligible for child care dollars, which are additional supplement, it can pay 100% of your costs all the way on a sliding scale. But last year alone, during the pandemic, when we actually had fewer than 2/3 of our child care providers open and most of our schools remote learning, $5.7 million in child care vouchers just alone, not even what parents pay out of pocket, flowed into our economy. Right? So that's the money as an industry that's going into childcare and being spent in our metro area and across our county. If you multiply this out over a decade, $40 million has flowed out into the community for childcare and subsidies, with an $89 million impact when economic multipliers are applied. Okay? So that's a substantial sum of money. That doesn't count anything in about lost work or wages per se when parents can't actually find childcare. Those are the economic numbers that the industry of childcare itself brings into our region. Next slide, please. And then COVID hit. As we all know, COVID had a huge impact. So what you're seeing here on your screen, and it's a little tiny, so I'm happy to share this data afterwards or give you in a large map. So pre-COVID, Eureka had a substantial presence, not enough childcare, but a big chunk of childcare located within the metro area. Okay. And this map actually indicates where the childcare was and just how dense it was. And the next slide will actually show you a year into the pandemic what childcare looks like now. So if you can see the map on your screen, you can see that there's a huge difference. And what we're really talking about too on an economic level is we're talking about small businesses in our community. Most of our childcare providers are small business owners, either operating out of their homes or operating centers in buildings within the county. This means that is a huge hit just from a small business perspective, let alone parents being able to go to work. All right. Let's go ahead and go to the next slide. So what do we do about this? And how do we think about this strategically and put long-term solutions into place to both support our childcare industry, support our working families, and support employers who cannot operate without staff? For this, we're going to turn to our panelists, and our panelists are going to introduce themselves, but I wanted to show a slide with their names and titles. And we're going to go ahead and move to the next slide, where these are our panelist questions. So let's go ahead and begin our dialogue, starting with Miles or Shannon, whichever one of you wants to start off by introducing yourself and telling us, just giving us the concrete idea about why you think childcare is important to economic development and the workforce.
Shannon, you can go first if you'd like.
Oh, thanks. I was going to offer it to you. Okay, so my name is Shannon Hall. I own and operate Little Learners. I have 4 centers with a total of 10 different classrooms. We currently have about 150 families. Typically, we have 300, but with COVID, we haven't increased too much. I've been doing it almost for 15 years, and I started out with 1 single classroom and have grown over the 15 years because of the high demand and wait lists that we have had within the childcare industry in Humboldt County. to answer your question, Kerry, so for me, I've been super fortunate on a partnership that I've created, that we created. But it's super important that we start thinking about rebuilding childcare, because I know of the wait list, because I get emails and phone calls all day long of parents needing childcare. And we know with COVID that we are rebuilding our economy, and for families and parents to be able to go to work, they need childcare. So it's got to be team effort. I'm definitely big on creating partnerships, and others creating partnerships, so that families don't have to choose to have a career or stay home. And obviously, I think it's really important for women, because they have, there are dads that stay home, but typically moms will make the decision to stay home instead of go back to their career. And right now is a really essential time for us to get parents back into the field.
Thanks, Shannon. Miles?
Hello, everyone. I'm Miles Slattery. I'm the city manager for the city of Eureka. In my previous position, I was the director for community services, and our community services department here at the city serves a lot of child care options for the city. We have a partnership with Eureka City Schools and their ACES program that we staff all of their after-school programs that serves over 500 kids a day in after-school programs. We also, kind of along the time when we brought forward our daycare center, we also noticed the need for more after-school programs. So we developed Outside the Box, which is an after-school program at our zoo that serves about 30 kids a day. And then we also developed a Cooper Gulch after-school program as well during that time frame. But our Little Slaplings is our daycare center. That was it's a state-certified daycare center run by the city. We serve 21 kids. It was developed about 2.5 years ago, and it was mainly in relation to recruitment and retention to provide incentives for people to come and want to work for the city. We have a competitive price for people that aren't city employees that are similar to other daycares, but we provide half price for our employees at that daycare, and it's been extremely successful. We have 21 kids, like I said, probably about 8 or 9, I believe, are city employees, and we give priority to city employees. And there's, it's 2.5 to 5, so there's people that are employees that are waiting for their kids to be potty trained so that they can get them in there. But for me personally, like Shannon had said, I would have never been at the city of Eureka when my wife was pregnant and we were living in San Diego. She had probably a higher career projection than I did, and I was going to quit my job to stay home with the kid because childcare down there was probably about 35 to 40 grand a year. It was more beneficial for me to stay home, and so that was the time that I started looking for a job up here in Eureka to where we could meet our childcare needs and also have an opportunity for growth in our careers. So I think that for me personally, it's been a huge thing, and also for our elected officials, Susan's been very much behind this and brought her economic development interest to the city of Eureka. And it was about the same time that we started our Little Saplings daycare, was when Susan was starting to work on her children's initiative for the city as well.
Thanks, Miles. So, Miles, you definitely touched on this. I'm so sorry. Susan, is there a way to control the echo?
I don't need to have 2 windows open by any chance.
I'm not hearing an echo from you, Kerry.
I am.
Oh.
Great. Well, let's forge ahead and hope that I can resolve it. So I think you already touched on this, Miles. And so, Shannon, I'll ask if you have some thoughts about how childcare, the lack thereof, has impacted your employees or your business or you. I mean, as a parent, as a childcare provider, as an employer.
So, it's a good question, Kerry, and it comes full circle. So here I am. I run, multiple centers, super busy all the time, and I'm a parent. And so, and I tell, if my kids weren't able to go to Little Learners throughout the whole pandemic, or being raised there, there's no way that I could have been operating my centers in order for all these employees to go to work. And, you know, and I'll mention in the future that we have a partnership with Open Door. And so there's no way possible that the doctors would be going to work or the nurses because I didn't have childcare. So as a parent, first off, it was essential for me to have childcare to be able to work. As an employer, you know, this is also a thing is staff retention. So we offer 50% off to our employees so that their children could come to childcare as well, and that we could keep our teachers. So in the long term, it definitely pays off because we don't have staff, we don't have much turnovers, and also in terms of being an employer is huge. That I am big on community based, and so, you know, helping people get back into the field of working. I can't stress the importance of it. And how many emails I get right now, and infant care is huge. Parents need to go back to work and they're having babies and there's no place for their children to go. So definitely has impacted me as an employer, as a parent, both. And so I understand how important it is to definitely have more childcare available.
Okay, great. Thank you. So it sounds like both you and Miles have experienced this like in every facet, as parents yourselves, as employers, as people who are in charge of or actually doing the hands-on care. So it just hits so many different ways. So the next question, and this is sort of one of the meat of our discussion questions, is what have you been able to put into place to address the need for childcare in our community? Like some of these more specialized solutions. And Miles, you mentioned, I'm going to turn back to you. You mentioned the development of the Little Saplings Center, which is actually a government-led solution for childcare and your workforce. You want to tell us a little bit more about that?
So yeah, like I said, it was, you know, we were having problems mainly with our police force and public safety and recruitment and retention, and weren't doing very well financially. And so we looked into this possibility of establishing pre-K daycare for our employees. And so we went through the process with the state. We had a facility at the Ryan Center that's on J Street that we needed to make some modifications to, and got certified. And then after we got certified, we opened up the daycare. It took a while to get our attendance up, but we've gotten it up now. We have a capacity for 24, and even with COVID right now, we have 21. And we're looking at actually expanding that now because we had a certain room that was used for ceramics that we've since cleared out. We're going to bring the state back up and try and increase our capacity so that we could have more. And then we're also looking at, because of COVID now, I mean, everybody's having a hard time hiring people, and we're looking at actually making it free for our employees. What's been good is we've been in the black with this program. It's paid for itself. It hasn't been a cost for the city. I mean, we obviously had resources in order to improve the facility to get it so that it can be certified, and also had the contacts for employees to, you know, staff the preschool. But from expenses and revenues, we're even offering 50%. We're still in the black, and so it's something I know it'd be very difficult for small businesses to do, but some of our larger employers, I would hope would either partner with somebody like Shannon, or, I mean, we've even discussed potentially using economic development money and starting a fund so that it could help, you know, subsidize some of the daycare at private facilities. You know, there's, like Shannon said, there's a huge waiting list, not only for the pre-K stuff, but also for older kids as well.
So Miles, is it fair to say that from the city of Eureka standpoint and from your experience with building the center, that this has been a good investment of the dollars?
Oh, it's been great. And I have to thank Shannon Fazio, is the one who did all the legwork of this and got it all certified and everything. And Nancy Donnell is our head teacher out there. And I'm sorry for butchering your title, Nancy, but I call you the head teacher. But it's got rave reviews. You know, our staff is fully supportive of it. Our facilities, you know, we have definitely a benefit. We have a park staff, we have a facility staff. We can make improvements and additions and maintenance and those type of things, make it a lot easier. But we just treat it like another facility that we have to maintain. And it's been great. Yeah, it's been a huge benefit. I believe EPD, of all the employees that are there, EPD has the highest contingency of their children attending that facility. And, obviously public safety is hard to recruit for right now. And so we need to look for these outside the box things, whether it's free memberships to the zoo or free, whatever it is, we need whatever we can do for a low cost to make it more enticing for people to work for us. It's definitely worked. It's been a great investment.
That's really, so Miles, that's really fascinating too, that like some of the highest enrollment families are the folks who are working in the city police department and, a necessary city service that you wouldn't be able to recruit. This is a recruitment tool for you, and that it's actually operating in the black. So an investment up front of the capital it took to start the center to get things up to regulation and code has paid off. But there was some upfront cost to it, but now you're actually operating and generating self-sustaining income with this center. And if you expand, that will actually also increase. So that's a pretty neat thing. So cities have these options. Shannon, let me turn to you because you have a slightly different, you have approached this as a business owner with another organization. So can you tell us a little bit about the solution for the child care partnership that you've done?
So I would say when I hear listening to Miles is similar kind of, that they partnered up with it's the county, but it's similar. So, about 5 years ago, Open Door, reached out to me. Kelvin kind of Kelvin View, basically, went to the board and they approached me and said, hey, can we create a partnership with you? And the partnership, has evolved. It started out basically providing care. We give priority to Open Door doctors, nurses, physicians, anyone that works with an Open Door. If you work with Open Door, you get a heads up on our waiting list. We do sick care and we do holiday care. But mind you that it's also created, we had this partnership in place before the pandemic. And so here the pandemic hits, it was the best partnership ever. And it's the partnership that kept little learners alive. Because there's no way we would have been able to function without this partnership. Not just financially, but being helped through the whole entire pandemic still to this day. So the partnership has been, for both of us, it has been amazing. They also do incentives, Open Door will get new doctors recruiting down in the city that, people moving to a rural community. Hey, we have childcare for you and it's half the cost, down in the city. So definitely we are constantly in contact. I never saw this coming. And then when the pandemic hit, I talked to other places with doing partnerships. I would definitely suggest other childcare centers try to do this partnership. It also helps me keep revenue, and it's really easy because it's the same facility. There is some, and I'm a doer, so I don't want to talk, Kerry. I'm like, let's go out and do it kind of thing, come up with the proposal. Go to, the city of Eureka, Arcata, say, hey, I want to partner up with so we can provide care for your employees, so that they could go to work. This was also a huge forefront for Open Door because they have a lot of physicians that want to create families. And, but they also want to be able to go to work and take care of their patients. So, and it's huge, and they also said they're not in the field of doing childcare. They don't want to do childcare. I tried to talk them into opening up their own center. And they're like, no, we want you to do the childcare. That's your expertise. Our expertise is working in the medical field. So let's see how we can help each other out. And, it has been very successful in the last 5 years. For sure. And it proven to even be more successful once COVID hit for us. So I definitely think that people in the childcare industry, hopefully there's more on the call, or even big organizations. I saw Papa and Barclays on there. They should actually outsource, basically go to some childcare centers or open up some buildings so that people can open up childcare centers. It's not easy for childcare centers to open up. AEDC has been hugely giving out loans to me for the last 15 years. And so they have been a great source. So for anyone that's willing, finding someone that wants to open a child care center, AEDC is a perfect place to start. So definitely partnerships. I'm all about partnerships. I didn't realize how fulfilling it was going to be, but it definitely has helped little learners be here still.
So thank you, Shannon. I think really important points that you made is one, you are a business. So accessing the resources that are available to any small business has been really instrumental to you being able to expand your child care centers, to partner with Open Door to make sure that there are slots. And I think a really important point you made, and I've heard you say this before, so I'm going to paraphrase what you say, which I think is so important. The top two expenses when you provide childcare as a childcare business in the industry are your rent / overhead and your payroll. And when you say that that partnership with Open Door, that private partnership was very stabilizing, some of this is, where the dollars are going to come from because you have an agreement. That means that you are much more likely to keep staff. Mm-hmm. You are able to hire and retain staff and therefore keep your doors open, keep those slots open. So as they recruit medical professionals, which our county desperately needs, they know what they're coming into. It's a quality of life factor. We know that shows up on all of these economic development surveys about why it's so hard to attract talent in our area. Mm-hmm. So I'm going to ask you the second part of that question, which I think you've already outlined, but has this been a good investment? So when you went to secure loans and invest in more space and invest in your business, was this kind of partnership a really good investment of those dollars?
Most definitely. It's been one of the, and at first I did it myself, but now I don't feel alone. And sometimes childcare feels alone because we're so segregated and not many people really care that much unless you're a parent, to be frankly honest. And even as an employer, like that's where I'm saying where employers need to really care more because they want people to show up. And so I did it out, but now I feel like I have a team. I can call Kelvin and say, hey, Kelvin, what do you think about this situation? Like today with the air purifiers. Kelvin, what kind of air purifiers should we get? So it's it's more than just let me provide childcare for you. It's all the others that come along with it, with the networking with Open Door as well. So in long term and also, Open Door, they financially kept us alive when COVID hit, but they also took care of their employees to make sure that their employees could go to work and their children had childcare. And again, if they didn't support us during those few months that were really tragic, we wouldn't probably be open. And then, and so it's a ripple effect, definitely, Kerry. So in the long term, it's definitely, it has been the best partnership. I never even suspected it because they approached me about it. So I never even thought about it until Kelvin said, hey, let's do this. And it's kind of evolved, of course, over the years.
That's also a really good point. So Miles and Shannon, I'm going to take us to the next question. And Miles, I'm going to turn this question over to you first. We have had some really rich discussions in preparing for this panel. So I'm really hoping we can put all of that out here because this is the second meaty part of this panel, which is what ideas do you have to improve access to childcare in the community? And what does it take to make these solutions possible? What are the concrete nuts and bolts from people to resources and everything in between? So Miles, what are your thoughts on that?
Well, from our perspective, kind of Shannon's model is a great model. I think that we have facilities that could be made available for people to lease, to start off a business like Shannon's and to develop it and kind of get through the early times. We're notorious for giving cheap rents. And, there's potential facilities that could be open, especially during the morning time and be used for childcare facilities. I talked a little bit about this before, but I think that, some of our bigger government agency and businesses, I see Linda Wise is on this, and I'm sure she's ready to open up a daycare center. But I think that funding to help parents and to fund and offset some of the costs with it, similar to what the partnership that Shannon has with Open Door, maybe some of the government entities here could commit a certain amount of funding annually and make that available for scholarships for qualifying children. I think just from the city's perspective, though, Cooper Gulch is a facility that we've just upgraded for an after-school program, and there's a potential there that could be leased out for programs. We're going to make some improvements to our municipal auditorium that used to be a school. There'll be some significant upgrades for that. But anyway, I think that there's some vacant buildings and potential to be used for daycare, and that could be rented cheap for people to start a business and also offset some of the costs for some of our employees that have to pay for daycare.
So Miles, thank you. I think the city and county roles are so important in our area. Whatever county we may be in, like they play a super important role, right? You had mentioned previously that, as a city government, where the vacancies are, what buildings are available, you have a good idea of the zoning laws. It's really possible for cities to come in and do things like tax breaks, like you would for any other industry, right? Or reduced rent, which you just mentioned on facilities that may otherwise not be being used and may be suitable. The idea too that as a city encouraging other employers within your city, because it's all a chamber of commerce issue, for example, that it doesn't take if you do this by yourself, it may take a lot of upfront funding. But if you do this in a partnership, especially with other industries or other businesses, and in partnership with city or county government, you have sort of an economy of scale costs, right? So as a business, you may be putting in this much, or as a city, you may be putting in this much. Instead of footing the whole bill, you're supporting the development overall that benefits. So I think there's a lot of important roles that cities and counties and the governmental entities play into this, as well as private business. Shannon, what ideas do you have? What does it take to make these solutions, like a partnership like you have with Open Door, happen?
So I think there's a few areas to point out, and Miles did kind of pointed out, childcare. So childcare is you go into childcare because you love it, okay? Because you love kids, because you love families, you love supporting. You don't do it to make money, and we all know that. You can make a living wage. I have to run 4, childcare centers basically to make a living wage, and so it's not. But it's very. I love my job a lot, and so. When I first started out, Arcata Elementary, they gave me low rent. That gave me the possibility to even open. I won the economic grant, AEDC. So using all of our resources in our community that we have, and we have a lot of them, offering the low rent. Arcata Elementary gave me the low rent. That's how I started out. I didn't. And so slowly building and offering these out to other child care centers, I think is a first start, Kerry, so that we could get more. So really we need more. Okay. And I'm not open anymore. But we need, and I love to mentor other people that are interested in opening centers. But also I feel like it's great if there were partnerships, so that let's say I have, Stacy over here that wants to open. Okay, I can help you and guide you through their loopholes. And then we got the county over here that wants to do a partnership, which is great. So she knows that she has people that are going to start coming to daycare, build up her repertoire and things like that. And so we need to start getting people out there basically that want to open up childcare. But also, hey, the county has these buildings, they're permitted. They have outdoor space, because outdoor space is always an issue generally for childcare centers. I've opened up many of them. I built a building myself because I couldn't find a building. And so the county has that option, which is awesome that they're willing to hopefully step in and offer, even smaller home childcare. Maybe they want to go larger to offer more spaces, which is a great opportunity. If, the county can offer lower rent to start out with, basically to get your foot on the ground, because childcare is a small business. It's not like, and once it's stable, there's no moving. There's no changes. Basically, we just stay stagnant pretty much with so many kids that we're going to have per room. Where other businesses, they go up and down, and so you could. Which is a big difference in childcare for sure. But I think we need to also having these partnerships huge. Like I've said, Kerry, before, St. Joe's, they should have a partnership, and definitely with a child care center. How many nurses are on the waiting list everywhere? The doctors, they can't get into places. And so they should definitely reach out and have a partnership with someone. it benefits both ends basically. And there's so many other big, the county for one, for sure, definitely should have a partnership with childcare or offer more spots within. I love to hear that they're growing little saplings as well. Hopefully just some infant toddler care, Miles.
Well played there, Shannon. Yes, infant toddler care is one of the highest needs.
Just be happy that Shannon Fazio can't answer that question right now.
Well, there's a lot of COVID babies right now, and I'm seriously, so many infants and toddlers need care. I've never been hit this hard, to be honest. And so, but a lot of people were home during COVID, and so a lot of people are having babies these days right now.
I think that's one thing that was the benefit of COVID. Not that many things were, but we've really adapted so that we allow for those employees that can work from home to be able to work from home. And it's been huge. I mean, we still do it to this day for those people that still have childcare issues and COVID. So, I mean, I think that really benefits, our employees so that they can stay home and deal with some of their childcare issues and alternative work schedules too.
That's awesome.
So let me go ahead. I'm going to just do a little bit of summary of a couple points, and then I'd like to turn it over to any of our attendees to kind of ask some questions and interact or offer some ideas, because we've got some good things being posted in the chat. So I think, Shannon, one of the other things that you'd said earlier in some of our conversations, and Miles, you said it too, is it takes a champion. Okay, so this just doesn't happen by chance. It takes someone who's willing to see these partnerships or develop these ideas from start to finish, somebody who's going to make sure that the conversations happen and that the funds, get advocated for, or the people get to the right places. And so it really does take someone within each. So say if you have the business to the private to private partnership or the public to private partnership, it's going to take someone who says, let's do this, and then makes it happen. We wring our hands a lot, but we all know that things get done because somebody puts their foot out, one foot in front of the other, and gets it done. So Shannon, for example, with Open Door, it was a doctor at Open Door, right? It was Kelvin. So, and he said, let's do it. Why not do it? Start the conversation and then see it through. And Miles, the same kind of conversation happened about opening little saplings, right? There's a million reasons why it can be difficult. There's a million reasons why it's easier to talk about it than do it, but it took some championing of saying, yeah, we're going to do this. And then it takes a person to guide it along. And at the time Little Saplings was being open, you were actually in the role of the Parks and Rec, right, director. You are now the city manager for the city of Eureka, but your role at that time was that this fell under your services, and you were the person who really helped prompt it through. It takes a team, but it also takes, someone who is saying, yes, I'm going to make sure that this gets done. So I think that's a really important thing. The idea of tax breaks and rental breaks and loans and grants. So, it's a combination. This isn't, I feel like a lot of the dialogue, and I just got off of the National Academies of Science federal webinar earlier this morning, that there was a big dialogue going on between economists on this webinar about childcare and childcare solutions. And some of them were saying it's a public service and it's a public good, right? So government should be, the one who really subsidizes and makes it happen. And somebody else was saying, well, it's a targeted market situation. And the targeted market is that you've got to have private business growing and developing this. And then both of them argued that neither one was doing a good job. So that led me to the thing that we're discussing here is it's not an either or, right? This should be something just like K-12. That all of our families should have access to care because our businesses need to be open, our city government needs to work, our county services need to work. It's a win-win. But it's not just private industry, and it's not just city or county or government responsibility. It's a combination of the two, and the partnership is a wraparound. And with that, we double impact our dollars, right? It's because you can access a lot of funding in small amounts that add up to big things. So now I want to open it up, and I believe that if anyone has some questions, Susan, I'm not sure as the moderator of the session, if that's something that you can help do, or how people might present themselves to ask questions.
If you are interested in just talking about this in a conversation like you would in a regular Zoom meeting, just turn on your mic and your camera, and we'll make sure to let you in. If not, you can post your questions over to the side. And Kerry, I could read them to you, or you can read them yourself, whichever is easiest. I don't know if you need me to scan it or if you can do it. But you can start with the things Linda was talking about.
Yeah, I think those are good things. Yeah. So Linda had posted in the chat that, and Linda, you may want to jump on and say a little bit more about this, but you posted, we worry about this all the time. The funding for providing childcare is the issue. Funding could be through EIFD. I wonder if Danco has planned for a facility in Samoa, business to engage with their employee enhancement programs and ask that childcare be addressed through their services. Did you want to say a little bit more about that, or ask any questions about that?
Miles, would you like to explain what EIFD is? I know you know now.
Sorry, I was muted. Yeah, it's the enhanced infrastructure finance district that the county is working on right now. Unfortunately, there's not going to be funding for that until we get some development out there. I mean, it's a great framework in order to get funding. It's just a matter of time before we can get it. I think it's also reliant upon a big, they're really hoping that the fish farm comes through, and when that comes through, it'll be a good funding source for that. I don't believe, Danco not Danco, but there was a proposal for a charter school out there. And that charter school was initially given the thumbs down by HCOE, I believe, and then it's been appealed now to another jurisdiction to see if that goes in there. But that would be more of a technical school for school-age children. It's going to take people to go, like when we expand. So when we first started, we didn't have good numbers and we were trying to recruit people. Then we started recruiting people, and then we got a good word out there and we started getting more employees. So we're close to our maximum. And when we expand to that other room, we could probably come close to doubling capacity. And that's going to take more staffing, obviously, but we could come close to that. And then at that point, we can evaluate what kind of partnerships we can develop and try and get more participation if we don't reach the numbers that we expected to. But, we have the ability to even use facility fundings to even add on and do things like that. But, depending on our workforce and where we're at and how many people are going to be participating, it's difficult. And we don't want to compete with private industry. We want them to have the ability to do it as well, but we also don't want to be taking things away from them. But we do want to support our employees.
The interesting thing about Danco and the whole development out in Samoa is really talking to them to make sure that they do incorporate childcare as part of their vision for that whole community. And like the city, Danco has the resources to do building and maintenance. So if their contribution is that they provide a center that somebody can get for a really low cost to lease from them, that could be really useful. And they have a lot of people that live out in the new construction, but then they also have the whole town of Samoa. So that could be an interesting discussion to have with them in terms of, I don't know how that helps their employees and what their incentive is to do it, but it feels like there are resources out there possibly.
Well, I was going to say to that. So Dan is one of my really good friends, and I wouldn't be Little Learners without Dan's co. So so Dan is so if not to say I want to open any more childcare, but I don't mind being the person to help out, to call Dan and be like, hey Dan, because he does childcare out in the cities and things like that. So Susan, if that's something that needs to start a discussion, I don't mind helping be a push for that, because me and Dan are both pushy people, and so yeah, I think, and I was going to say on that, networking is huge. It's almost who you know a little bit, and having pushy people like me and Dan to get things done. I mean, not to, say, but so networking and knowing people, and Miles, you probably know someone, and spreading the word, basically.
So Shannon, I think you raise a really important point in a couple different ways. And one is that it's not necessarily a lack of desire, it's a lack of awareness, right? So if you call Dan up, or Miles had a conversation, or however the conversation happens, it's that the conversation needs to happen, and sometimes it doesn't. So it's not really on the forefront of the thought, but once you start talking about it, you're like, oh yeah, no, that makes complete sense, and we need to be very forthright. I'm also a pretty pushy person. Never met any conversation I wouldn't insert childcare into. So having that awareness, and what is the ask? You may not be asking somebody to do 100% of that role, but you may be asking them for, like what Susan raised. Hey, is there room to make sure that this gets incorporated into what you're building? And if you're building it, are you willing to support a childcare business to come in and provide? Because I think Miles, Little Saplings, is like a living, breathing example that is something that's going to operate in the black, because the need is so high that even if you're reducing the cost for your employees or the people that you're prioritizing for enrollment, you are still going to come out in the black for it. But you need that little bit of support. And Linda, unfortunately, her camera and accessibility wasn't working, but she's posted some things in the chat, including the actual link where we can put suggestions in about Samoa, where those are being taken. And I think that's the other thing too. People need to be active, and not just parents, right? Employers, businesses need to be active and say, hey, I cannot have a workforce if I don't have options for childcare. My folks can't show up. And if school shuts down because the classroom, they have positives, especially with the pandemic, people won't come to work because they can't. I think that there's a lot to be said here, and how we approach these conversations and why we're not talking to each other. There are a lot of jurisdictions, so across California, certainly nationally, where cities and counties have actually built into their economic development plans the consideration and the feasibility for childcare to be incorporated in anything that's being built, right? That there has to be some kind of thing, not in an onerous way, because I know more regulations, more requirements, that's huge, but just making sure that it's always a part of that conversation. How are you accounting for new workforce coming in, and how will people be able to access childcare? Do you have space for it? It's sort of like the mixed development units you see in very large cities, right? You have retail on the bottom, you have living space on the top, and then you have some space that's maybe more community driven. Well, childcare is a business. This can be built in. It can always be built in. We have some more. Okay, so we have a question. Are there many training or other professional development support resources available for people who might be interested in starting their own center, but who are intimidated by the process? And what kind of community?
Just call Shannon. She'll take care of
you. Call Shannon. You can also, and Shannon is a fabulous resource. But what Shannon has said, there's also a network, right? There are multiple providers across our county, some who operate centers. So those are larger scale childcare, and some who are family childcare homes, because sometimes that's a better place to start. For some folks starting in family childcare, you may start with a license for 5 or 6 children, depending on their age, and operate it out of your own home, and really build what is a grassroots small business from there, and then decide if you want to expand. And we have definitely seen people start at that level with 1 or 2 kids, 5 or 6, a little bit more in their family business, and then go out and decide that they want to actually open a center and look for facilities and buildings. So you can also call Changing Tides Family Services, and I'll put that information in the box. It's one of the functions my agency actually also does as a resource and referral in our area. We walk people through the process of getting licensed, and we help connect them to people like Shannon and family childcare providers who are mentors in our area, who also help support getting licensed and what it takes to run a business and what you need to know. So there's a lot of support out there, but sometimes folks aren't sure how to access it. So, and I'm sure if Miles or Shannon want to share their contact information to folks who have questions about how to start some partnerships, I will also put mine in there. So
Yeah. Oh,
go
I'm
ahead,
sorry.
I'm sorry, Miles. Go
And
ahead.
you can put my email address in there. I was going to say, when you're looking, if anybody is interested in doing, I think speaking with our planning department is really important, because you can get caught up into a lot of stuff where you want to ask those questions beforehand before you put anything forward, because you could have parking issues, you could have zoning issues, you could have other things like that. So you want to make sure that you are interested in doing this, that you come and ask the questions, and make sure they're in the form of questions, not as statements, so that when you get a response, you can maybe pivot and answer that question, ask that question in a different way that gets the answer you're looking for.
That reminds me of an interesting story that happened in the city of Arcata. They were trying to address some issue, and I don't know what it was, but what they ended up doing was writing an ordinance that essentially made family child care centers in neighborhoods illegal, which, became an immediate and apparent problem, and they fixed it right away. But I think the important lesson in there is that we don't talk enough about the importance of those family child care centers as businesses. So they just get forgotten. So when we're talking about zoning and all of those rules that they need to go to the city about, it's nice to have a city who has actually thought about them.
That is a great point, Susan. And a bulk of our childcare in the county is actually provided by the small family childcare providers in their own homes as small businesses. For a lot of parents, the number one thing that's so important about childcare is that you know who is caring for your children, and you know they're going to be safe, you know they're going to be loved, and you know that they're going to get the highest quality. That's what this is about, Shannon. That's what your business is all about. Those three things are the top things. That's what drives our industry, and they're all critically important. But at the end of the day, surviving in an economic way is what helps keep that care at that top quality of care, concern, safety, and love for the children. So we're at 153. So happy to have some more questions come up in the chat, but we're going to do a bit of a lightning round. Okay. And with closing thoughts. So, and Susan, I'm going to include you in this lightning round too, because you've been a real champion of childcare, and it's always good to have your thoughts too on this. So, Miles, why don't you kick us off on this? So, in 30 seconds or less, what final thoughts do you want to share or leave us with about childcare?
Just what a benefit that it's come to us. I mean, we've always heard from people that money is how you retain people and recruit people. And I think that we have, in certain instances, thrown money at things and learned that it actually didn't work. I think that not only does childcare provide the incentive for people to come and work for you, but it also demonstrates how much you care for your employees. And I think that that goes a long way in making your your work more like a family environment, and recognize the importance of childcare. So, for us, it's been outstanding, and I think that expanding on it will be just that much more better. As soon as council approves us giving it away for free, we'll be giving it away for free.
Thanks, Miles. Shannon, what are your final thoughts on, or something that you want to share about the importance of childcare?
My final thoughts was that I would like our community to some bigger top people step up, make it some things happen for working families so that they can be back in the work field and there's quality childcare for their child to attend.
Thanks, Shannon. Awesome. Susan, how about you? What's a final thought, your pivot point on childcare?
My pivot point is that I think a lot about childcare and how it feels like an issue that is so much bigger than we can solve in our own community. Like it has to be done by the state or the federal government. And truly, we do have to make changes there. But I'm so excited to be able to find examples of how we really can make a difference right now and right here. And there are more opportunities. And the more we talk about it, the more people want to do it. So the county really is trying to figure out how to use some of their ARPA funds to support childcare businesses. And I think that is something that may not have happened they're having the conversations nationally, but I think it's the local conversations that really get their attention. So it feels like, Kerry, I know you said it, and it feels like I'm talking about it all the time. But when everybody starts talking about it, I'll talk about it less.
Or we'll just get to a place where, just like we talk about revenue, we talk about overhead, and we talk about everything else, childcare is in that same breath, So my takeaways from this session, and in general from the work that's being done around childcare and economic development in our community, is these things are possible, right? There are larger scale changes we all want to work for. And some of that is, what Miles highlighted is that eventually dollars are not the only incentive. And for a lot of families, they're not even the most important incentive, because you can get additional funding or additions in your paycheck and still not be able to have childcare. So there are things that are just quality of life out here that make it hard for us to recruit and retain people in our community that we really need: medical professionals, police officers, social workers, mental health professionals, retail business, everything. So childcare literally touches everything. But for me, I'm always the concrete person. I want to keep an eye on that long game, but I want to make sure that we have the nuts and bolts solutions. And I think we do. We have those solutions. We heard about two great examples, one really led by city and government and public dollars, and one really led by private industry and private partnerships on Shannon's end. So please take these thoughts. And the other thing is, as constituents in all of our counties, let those supervisors hear that this is a driving force in our economy, because $5.7 million out the door just in subsidized, not in complete dollars, and a $40 million impact over a decade, and $89 million in multipliers in access and employees showing up for work and productivity in our local businesses, that's a huge impact. So even if you are not a person who is all about children, which a lot of us are, you are still about seeing our economy be healthy and our communities thrive. This is a win-win investment, and it is both a short-term shot in the arm. It is both about regulations and supports from the governmental sides, and it is about private industry and partnerships. These things can happen, and we can do them, and we can do them now. So thank you so much for being in this conversation with us. It is 1:58, so unless there are any other questions or concerns or comments, we're going to go ahead and close this session.
I just want to make one comment, because
of course,
that I think is important. I think that Eureka City Schools may be coming out. There's some funding that's becoming available for pre-K preschool, and there's some things that need to happen in order for that. But there should be information coming out on that soon, where Eureka City Schools is looking at developing ways to where they can secure this funding. Some of the ways may not be popular, but it definitely would provide for more childcare, especially for pre-K kids.
Absolutely. Thank you, Miles. Yeah, there's money coming in other ways. And actually, this is a pivotal moment in general, right? Because the federal government has given the states money at their discretion. The states have decided, especially our state in California, to allocate towards early learning and care, to stabilize the workforce, to stabilize the business industry of that, and also to make it more accessible to families. And again, the national conversation I was listening to this morning, the two most effective things that have shown up over time, especially in the critical short-term data in the last 3 years, are reduce the cost for families, eliminate family fees or contribution, make it a flat influx of vouchers. So all families have access to childcare. Huge impact on workforce and ability of employers to hire and retain staff. And then the other one is to stabilize the workforce by reducing regulations, maintaining safety, but reducing regulations and improving access to the dollars that stabilize. And so I will say there are a lot of different ways this is being approached, but some of our sister counties and other parts of California are actually choosing as counties or cities to help increase the rate that childcare subsidies operate at. So if a private provider like Shannon accepts subsidized care vouchers for families, that some jurisdictions are choosing to make a 3 to 5 year commitment to increasing the rate and matching it as a way of retaining workforce and as a way of stabilizing childcare. So there are a lot of options for this. And there are many, many ways to tap into all of those dollars, including what's coming down for TK in the K-12 system.
Right on. That's a lot of stuff.
All right. Well, thanks everyone. It's 2:01, and Susan, I didn't know if you wanted to respond to David's question.
Oh, what was his question? I'm sorry, I moved over.
He said, "Quick question: does the demographic of the attendees strike anyone as telling?" On occasion, indeed. Thanks so much,
thank
everyone.
You for coming, David. Bye-bye.
Thanks.
Thank you to our presenters and panelists, and thank you, Susan. We appreciate you very much. See you in the other sessions.
Bye.
Bye.